What is it about the thoracic spine that makes it such a challenge to assess and treat? I'm not talking about the 20-year-old gamer that needs to lie down on a foam roller once in a while, or the gym junkie that needs to train more than the muscles that they can just see in a mirror, but the patient that wants to break past their plateau, achieve a higher level, or has tried the usual tricks and they aren't working. So what are some of the common pain points of assessing and treating the thoracic spine? Well, let's start off by just the sheer anatomy of the area. We've got 12 pairs of facet joints in this area, 10 pairs of costotransverse joints. We have muscles that cross into the cervical and into the lumbar spine. Some of the muscles in the area are supplied by the thoracic spine, but some are supplied by the cervical spine. We've got an area designed for mobility and yet stability at the same time. We'll often find patients that even though they have seemingly restricted movement in their joints, that we teach them stretches and teach them exercises and their patterns don't change. And the worst part is when you can't explain to your patient specifically what's causing them to plateau and you're just tossing things at them hoping that something will change it. If the patient's not buying in, they're not going to book back in and you can't get them better. Well, maybe research studies can guide us. To an extent, they can, but there's not a lot of studies in this area, and there's a high variability even within the studies. We do know the research says that there are impacts that can happen in the neck with treatment of the thoracic spine, that there's effects that can be found with shoulder type of symptoms, some more than others, that there is a benefit potentially for certain low back people, in which case we can treat this area and improve their symptoms. There's even been indications of coccydynia being influenced by thoracic techniques that are being performed. But when do we move towards them? Is the thoracic spine something we just move to by default? Because if it is, we're just guessing, and our patients don't pay us to guess, they pay us to assess. When it's clear that we're guessing, that's when we start to lose some of that trust factor with them. So let's chart a path forward. This course is going to help you to identify the patients that will benefit from localized and targeted techniques and the tools to treat them, the techniques and tools to retrain motor patterning, global assessment and treatment tools, and how to build a toolbox of more than just foam rollers, million-dollar stretches, and prone PA techniques. The course is presented as a series of online recorded presentations that cover everything that you're going to need, from the relevant background material to video presentations of cases, assessment, and treatment techniques. It's a practical course and it's case-based that you get to work through at your own pace. There's no additional subscriptions required to keep access to it either. The material is being taught by an experienced group of physiotherapists out of a combined teaching and mentoring history of over 25 years. You'll be seeing and hearing us on the course content. We'll bring the thoracic spine back into focus for you.